Hi, my name is Soyla Mendoza, and thank you for the opportunity to present today. Today, I will be presenting on a school based trauma informed support program designed for immigrant youth. This presentation is structured um, for school faculty and the school board members with the goal of proposing a program that addresses migration related trauma, promotes emotional safety, and supports academic success. The program I'm proposing builds directly on research focus on trauma informed care, transcultural competence, and tier 2 interventions within the MTSS. For our agenda today, the purpose of this presentation is to walk you through a proposed school based intervention designed specifically for immigrant youth who have experienced migration related trauma. First, I will be providing a brief overview of the program and the population it is designed to support, followed by the need for the program by explaining how trauma impacts immigrant students, emotional well being, and school functioning. I will then review research evidence that supports trauma informed and culturally responsive practice for immigrant youth. I will also discuss challenges and barriers schools may face when implementing this type of program. To make the program concrete, I will share an example activity that shows what the student would experience. We will be finalizing by explaining how the outcomes would be measured and how the student progress would be tracked. Together, we want to reflect on a comprehensive evidence based approach to supporting immigrant youth in schools. This presentation proposes a trauma informed Tier 2 support program designed specifically for immigrant youth in school settings. The program is intended for students who have experienced migration related trauma, including exposure to violence prior to migration, family separation, deportation stress, and ongoing adjustment challenges after arriving in the United States. This is a Tier 2 intervention within the multi tier system of support, meaning it is targeted for students who need more support than the school wide interventions, but do not require intensive individual services. The program is grounded in trauma informed care, which emphasizes emotional and physical safety, trust with caring adults, and understanding of how trauma impacts behavior and learning. It also incorporates transcultural competence by recognizing students' cultural identity, migration histories, and strengths gained from navigating multiple cultural environments. The intervention would be delivered in small groups, facilitated by a school social worker. Group sessions would focus on helping students develop coping skills, regulate emotion, reduce stress, and increase their sense of belonging and connections within the school community. This program is needed because many immigrant youth experience trauma across multiple stages of migration, including exposure to violence, instability, and poverty in their home countries, as well as the fear, uncertainty, and unsafe condition during migration process. This is all based on research. Even after arriving in the United States, stress often continues. Immigrant students may experience discrimination, cultural adjustment challenges, and ongoing fear related to their own family immigration status. These chronic stressors can negatively affect the students in how they feel at school, in their ability to regulate their emotions, in their engagement in learning. When it comes to the family separation and reunification, there's also a significant emotional distress. Research show that youth who are reunited with caregivers after a long period of separation may struggle with trust. Research evidence and trauma informed care. Research has indicated that it supports the use of trauma informed care for working with immigrant youth in school settings. Studies have shown that immigrant youth often experience trauma at multiple points throughout migration, including exposure to violence before migration, stress and fear during migration journey, and persistent stressors after arriving in the US, such as discrimination and fear related to immigration status. Trauma informed care is effective because it shifts the focus away from viewing a student's behavior as a problematic and instead encourages to understand the student's behavior within the context of their lived experience rather than asking what is wrong with the student. A trauma informed care asks what has the student experienced. And this is based on research. And I have the link below. Research also explains that trauma informed practices prioritizes emotional and physical safety and developing a trusting relationship with caring adults. So when it comes to culturally responsive and tier 2 supports, research has indicated the effectiveness of trauma-informed programs when they are combined with transcultural competence and targeted tier 2 interventions. I have linked the research below. It has emphasized that immigrant youth navigate multiple cultural contexts daily and benefit when educators intentionally recognize and affirm their cultural identities within the school settings. Research has also indicated that transcultural competence encourages educators and school staff to reflect on their own cultural background and biases while developing authentic relationships with their students. Furthermore, research has described immigrants' youth ability to move between cultural as transcultural capital, which includes adaptability in communication skills and resilience. While research supports trauma-informed and culturally responsive interventions for immigrant youth, there are several challenges to implementing these programs. So one of the major one would be limited school resources, including time and staffing, and the access to trained mental health professionals. Another challenge would be the lack of training in trauma informed care in transcultural competence. Um, it would be also difficult as immigrant youth may not openly disclose their experiences. And this is based on research. There's also the fear and the distrust from families due to immigration concerns. So the need for culturally responsive implementation across systems. For this sample activity, a tier two small group session, the activity would take place in a small group setting with approximately 6 to 8 students that identified with being an immigrant. It would be facilitated by a school social worker. Um, each session would follow a trauma informed principle where a emotional safe environment, a safe place would be for each of the students. The session would begin with check-ins to allow the students to share how they're feeling, followed by a small discussion um, of about their stress and their coping. Students would then engage in activity that helps them identify coping strategies and then supportive people around them and cultural strengths that help them manage their stress. Overall, this activity would demonstrate how trauma informed, culturally responsive tier two interventions can be implemented in a supportive way within a school environment. So, when it comes to measures, student outcomes, the effectiveness of this program would be to evaluate the students' emotional, behavioral, and school related outcomes. That would be by looking into the students' improve emotional regulation and students' ability to manage stress more effectively, a student's perceived sense of safety and belonging at their schools, their engagement in learning, and their school relationships. This program aims to strengthen resilience by recognizing the students' cultural strengths. When it comes to progress tracking and the evaluation methods, we would be looking into the student self reflections and check ins, right, with the social worker and the student. We're going to be looking at behavioral and emotional changes. We're going to be looking into attendance and classroom engagement. We will check in with teachers and staff to hear their feedback and ongoing family collaboration. In conclusion, research has indicated that immigrant youth experience unique migration related trauma that impacts school functioning. Trauma informed and culturally responsive tier 2 support addresses both risk and protective factors. Research supports small groups, strength based interventions. School plays a critical role in promoting safety and resilience and belonging. Implementing these practices supports immigrant youth's emotional well being and academic success. Thank you for listening to my presentation. And in the last slide, I have all the references if somebody wants to look into any of the research. Thank you. References used.